Hi class, my name is Jacqueline Tankersley and this is my quantitative study scholarly presentation. Now, the study that I was assigned to was the effects of standardized patient simulation prior to mental health rotation on nursing students' anxiety and communication skills. Significance of the problem. So, research expressed how stress and anxiety experienced by nursing students starting in mental health clinical practice can have a negative impact on patient care. Some of the students that are starting their mental health clinicals may not have experience dealing with patients who are suffering from a mental health crisis. The researchers sought to find out if simulations can decrease anxiety and stress, improve therapeutic communications between nursing students and patients, thus providing effective health care. The significance of nursing practice. This study is of great relevance to nursing practice since it focused on stress and anxiety that student nurses may experience that can cause ineffective communication and treatment to the patients. So, as in regards to therapeutic communication, student nurses need to have good verbal and nonverbal communication skills, dealing with patients who may be suffering from suicide ideology, who may be having a mental health crisis, depression, schizophrenia, all these diagnoses. So it's really important to have good communication skills, able to escalate situations. So the effective communication with psychiatric patients improves outcomes and decreases their anxiety by providing effective and safe treatment. Questions, hypothesis, and or purpose of study. So in this study, there were two hypotheses that was mentioned. The first hypothesis is the anxiety of nursing students who take mental health and psychiatric nursing courses that uses SPS, which is the simulation, prior to clinical practice will decrease. The second hypothesis is the communication skills of nursing students who take mental health and psychiatric nursing courses that use SPS prior to clinical practice will improve. And the purpose of this study is to determine the impact of simulation prior to clinical practice on the anxiety level and communication skills of nursing students. And the researchers did not provide questions for this study. Conceptual model theoretical framework. The researchers did not provide an explicit conceptual model or theoretical framework. The researchers specified that there were no studies determining the relationship between simulation and anxiety with nursing students starting mental health clinicals that would improve communication skills and patient care. Protection of participants' rights. So the researchers were able to get ethical permission by the Ethical Board of Medical Studies of University A. They were able to get institutional permission from both universities, and they were able to get verbal and written consents from all the participants. Research design, population sample, and settings. So this study was an example of a pre-test, post-test control group design. There were two groups in this study. One was the intervention group, and the other was the control group design, or the control group. The intervention group is the one that had to do the simulation. So the sampling consists of 103 nursing students from two universities. They did complete 3 years of nursing school, and they had already completed the mental health and psychiatric nursing classes. Now, the study took place in Advanced Simulation and Education Center of University A, and that center was certified by the network of accredited skills centers in Europe. intervention and variables. So the independent variable in this study was the standardized patient simulation. The dependent variable was the nursing student's anxiety and communication skills. Interventions. So all the nursing students had to sit in a 2-hour theoretical lecture on communication skills and a 3-hour theoretical lecture on schizophrenia. The intervention group were the ones that did this simulation, which was 10 to 12 minutes long, and each participant analyzed the scenario for approximately 30 to 35 minutes afterwards, and the participants were given feedback by the instructor. And also the participants were able to verbalize how they felt during the simulation. Data collection and measurable strategies. So personal information questionnaire, communication skills inventory, and state trait anxiety inventory was all used to collect this data for the study. Communicational skills inventory and state trait anxiety inventory were tools used to score the pre and post test. Now, the communicational skills inventory, which is the CSI, determined cognitive, emotional, and behavioral communication skills, and the state trait anxiety inventory, the STAI, helped measure anxiety. So there were limitations to this study. The students were able to communicate with each other after the scenario. The students did deny that they did not share information about the scenario with each other. And the researchers did not object to this, did not have any objections. With this study, there was a good sample size. So basically the limitation, like I said, was that the students were able to communicate with each other after the scenario. Findings. So students who received the SPS, which was the simulation, had decrease in anxiety levels and increase in communication skills. There was no statistically significant difference between the intervention and control groups from the STAIs, the STAIT, CSI, and subscale CSI scores. Now, I was able to find the tables worth all the scores and was able to put it on this slide. So table 1 was the comparison of the anxiety and communication skills pretest scores of the intervention and control group. Table 2 was the comparison of the anxiety and communication skills post-test scores of the intervention and control groups. And the third table was the comparison of the pre-test and post-test anxiety and communication skills scores of the intervention group. Implications for practice. Fear, negative attitude towards psychiatric patients, and fear of causing offense can all contribute to the stress and anxiety nursing students have when completing mental health clinicals. Researchers stated that study was able to determine that simulation prior to mental health clinicals can decrease anxiety and improve communication skills, which can result to more effective care to patients. This is my reference page, and thank you for watching my presentation.